What is serum prolactin test? How it is performed? Why it is performed? And what should be the normal level of prolactin hormone? And what all precautions you need to keep in mind before undergoing this test? We will discuss about all of this and much more in today's topic. Namaste. My name is Dr. Tanvi Mayur Patel. I am an endocrinologist, hormone specialist doctor from Mumbai, India. Our today's video is a part of our prolactin hormone series video. This hormone is a very important and very few people have a knowledge about it. And that is the reason why I have made one entire playlist so that people like you whose interest in such hormone will get benefited. Okay, so today we are going to talk about the serum prolactin test. So what is it? So it's actually a blood test. It is not a CT scan or MRI or any kind of a scan. It's a plain simple blood test which you can do from any of your nearby laboratory. When you go there for your blood test, you have the phlebotomist over there will collect some blood from your vein. Usually we take an arm, okay. So some blood will be withdrawn from your arm and this venous blood will be sent to the laboratory for the testing. Usually the reports arise within a day, but if you are located in a little small or the remote setup, the results can take maybe 2 or 3 days time. This blood test is not very expensive test. Here in my country like India, the test cost varies from city to city and village to village, but it can vary anywhere from 100 to 450 rupees. Okay, that is the blood test. Okay, when you should do the testing, very common. Okay, ideal time to do this blood test is between 8 to 10 a.m. Okay, but within 4 hours of waking up, you can get these tests done. Now, why this particular timing is important? Because the secretion of the prolactin hormone is a very unique. It happens in a pulsatile manner. Okay, so early morning, the level of the hormone is much high. As the day progresses, the hormone level starts going down, and that is the reason why early morning between 8 to 10 a.m. we usually ask a person to get their blood test done. Now usually this test is more recommended for women, and the very common question that women have is, can we do this test during pregnancy? Answer is yes, you can do this test during pregnancy. Can you do this test during your monthly cycle? Answer is yes, again you can do it during your monthly cycle, no problem with that. Another important question, is fasting required for this blood test? Answer is not actually. Okay, fasting is usually not required, but if you are doing not only prolactin test but some other blood test for which fasting is required, it's absolutely okay. But if you are doing only prolactin test, fasting is not necessary. If you do fasting or if you don't do fasting, the results is not going to change. Okay. Another common question, I am taking so and so pill, can I take it? Answer is yes. If you are on medication, let's say for thyroid or for your diabetes, blood pressure or any of the health problem, if you are taking medications for that, you can consume them and do the blood test. There are no as such strict contraindication of not consuming certain pills while doing a prolactin blood test. Okay, so these are the commonly asked questions. Now another asked question is why your doctor has given you this test. Why your doctor feels that you need to get these tests done. Let's find out the indication. So I'm going to discuss indication in women and indication in men. Okay, so first let's talk about the indication in women. Why a woman is asked for the blood test. So reason could be if your doctor suspects that you have a thyroid problem, or if you have a polycystic ovarian syndrome, PCOS, then your doctor can ask this test. Okay, if you have a thyroid problem, you are on medication, but on a routine screening this test can be asked. or if you are not sure that do you have thyroid or not, in that situation also this test is usually asked to perform. When your prolactin level increases, a woman usually experiences disturbances in their menstrual cycle. They can have a disturbance in their menstrual cycle, they can have ovulation problem, they might skip the cycle, or there might be delay in the cycle. So when you have any of such issues, your doctor will ask you to do this test. Not only that, if you are married and if you are planning for pregnancy and for some or the other reason you are not able to conceive, you are going through fertility issue, infertility, then your doctor can ask you to do this test. Okay, if you are having dryness over your private area, okay, or if it is very difficult for you to have an intimate relationship with your partner, this test can be advised. Sometimes a doctor might suspect that you have a small tumor in your brain, in your pituitary gland. On such suspicion also, a doctor can ask you to get these tests done. So if you are having any kind of a headaches, or if your vision is disturbed, or if you feel that there is a milky discharge from the breast, in such indication can also be asked for the serum prolactin blood test. So these are the common indications we ask for this test in a woman. Let's talk about men. Okay, so of course in men, if you are taking any kind of a medication, especially the psychiatric medication, then yes, if your doctor suspects that you have a thyroid problem, if you have an infertility issue, or if you feel that your sexual drive is low, you don't have that much interest in physical relationship, or if you have any kind of erectile dysfunction, in all such condition, your doctor can ask you to get these tests done. If your doctor suspects that you might be having a tumor in your pituitary gland, or prolactinoma what we call, then also this test can be asked for. So these are the common indications which we usually ask the test. Of course, there are plenty more than that, but these are the most common indications. So once you do your blood report and you get your result, so let's talk about what should be the ideal value. So in case of a woman, the level should be anywhere between 0 to 25 nanogram per ml. In case of a man, the level should be between 0 to 20 nanogram per ml. And if you are pregnant, of course, this hormone will be much higher. It can vary anywhere from 80 to 400 nanogram per ml. So these are the common levels. If it is in that range, you need not worry. Okay. Now, one important point which you need to keep in mind when you are going to do this test, certain don'ts which you should not do. Okay. You are not supposed to do this test immediately after exercise. Okay, because plenty many times, okay, when you do exercise, your physical stimulation is there, prolactin hormone increases. In fact, prolactin hormone is called as a stress hormone. So exercise is a kind of a physical stress for your body. So prolactin level will be high after the exercise. Just prior to doing the blood test, if you were in a intimate relationship, okay, again your level can be high. If you didn't sleep well, you had a disturbed sleep, or you slept late, the prolactin level can be impacted. And one important thing, plenty many times we ask women to do this test because a woman complains that they are having a milky discharge from their breast. So we have seen some women tries to stimulate their breast and they want to remove such milky discharge and think that if I do this, my level will change. If you have such problem, don't do that, because on a stimulation of the breast, prolactin hormone rises and it might happen that your result might not be perfect. Okay, so that precautions you should keep in mind. All right. So that's what we discussed about prolactin test. Okay, I hope after watching this video, you got some good and useful information. If yes, please click on the like button. If you are new to my channel, then don't forget to subscribe so that you get more and more health related, especially hormone related information. And if you have any of your personal question whose answer you are seeking for, then write that in the comment box below. I try to read and answer them as early as I can. My clinic is located in Mumbai, India, and in case if you are interested in reaching out to me for one-on-one consultation, you can reach out to my staff on her WhatsApp number. The number is 9987829999. One more information, if you get interested in watching these videos in Hindi or Gujarati language, I have a YouTube channel in those languages also. So if that language is of your interest, please check out those channel. You will be much benefited. Alright, we will meet again in some another good useful information. Till then, take care of yourself. Namaste.